writing me. Okay, so we officially started. So I will try to discuss some basic definition related to XAI and XAI in medicine. And it could be a starting point for discussion afterward. So the first observation is that within artificial intelligence in medicine, we had in the last, I would say, 10, 15 years, a drastic shift from knowledge-intensive application, focusing on how to represent the reasoning mechanism, how to represent the knowledge at disposal of physician for reaching some right conclusion with respect to the state of the patient, to data-intensive application. So the main focus now is you have a lot of data to consider, to interpret, to mine for obtaining the right information at the right time. And so we moved from system that advise to system that provide this ad hoc information. And obviously, these systems are able to understand the reasoning mechanism, but the idea is not to try to simulate the reasoning task of physician, but to provide physician with further information useful to this decision-based task. And one of the issues in this kind of support to versus the huge amount of data we have at disposal is that in medicine we have heterogeneous data, so we have not only demographic and alphanumeric data, but we also have signals, images, genetic data, bioinformatics data, now also social network data, and we have also to integrate and to represent in some uniform way and homogeneous way this kind of heterogeneous data to support the clinical task. So the consequence of this situation is that knowledge related to such data is extremely valuable, multifaceted, interdisciplinary, and this kind of intelligent system are becoming really important. Even after COVID, they are more important because COVID produced again a further huge amount of data to consider in the clinical task for supporting decision in many different possible tasks, diagnosis, therapy, but also recently healthcare policy assessment. One of the support recently appearing and being even more important is how to support healthcare decision with respect to huge population that have the right to travel, but they have to be protected and so on. So in any case, the idea of AI medicine, even with this kind of shift, is that the support of care providers in reaching the best possible solution with respect to the decision they have to take at the right time, and to see and to help and support them to see the consequences of their decision and action to do some kind of prediction about the evolution of the patient or about the evolution of population. And with respect to this kind of support, there are many possible techniques. Now we are in a period where AI sometimes is implicitly considered as machine learning. It's not the case. AI is wider than machine learning. We have many possible kind of representation and reasoning techniques and mining techniques of the data that are not only machine learning based, but I highlight the machine learning in medicine in this slide because mainly machine learning provides some further issues because sometimes it is not possible to understand why this kind of techniques are producing a result, are producing a suggestion, are producing some conclusion. So in this case, XAI become, the explainability issue becomes even more important, even to also with other techniques is not really clear to the final user what is the mechanism for reaching some conclusion. So the problem with this kind of deep learning, machine learning based methods is that they can be considered like black box. The conclusion they provide are not clear in the mechanism that create. So we want to manage mainly two different issues. The first one is to understand why there is some prediction of classification provided by these tools. What is the reasoning mechanism, the processing algorithm that allow to one to reach this kind of conclusion. And the other problem is that when some of these methods provide some suggestion, you have to be sure that there are no errors. And if you don't know how the system works, it's not so simple to understand whether there are errors in the data or errors in the tool with respect to a possible suggestion or decision. So what is explainable AI? Explainable AI is not only medicine, obviously, because it is related in any case to this kind of black box behavior of machine learning methods. And I use this definition from Wikipedia. Explainable AI refers to methods and techniques in the application of AI technology such that the result of the solution can be understood by humans. That means that it could be that there are some specific techniques not related to obtaining some prediction, but related only to explain why we had this kind of prediction. And this kind of techniques could be different. The AI solution supporting a decision could work in a black box way, while other techniques allow you to understand why some conclusion have been reached. The way in which this support is provided could be really different, from visual representation of data to some data example, to some kind of reasoning explanation and so on. What is the motivation for XAI is the interpretation, error discovery, also bias avoidance, trust. We need to trust in the conclusion of these tools. And with black box tool is not always the case that we really trust. And then we want also to improve the performances of this system. So why we need it? Why we need XAI in medicine? This message is not for you. It was mainly related to other presentation I did with clinicians that were worried about their role with respect to this kind of tools. XAI and AI in general will not replace clinician, in my view, will not replace medical professionals. They will support them in even more difficult tasks in the future. And so, according to this perspective, XAI medicine can be viewed as the discipline that deals with the explanation and interpretation of results to support clinical decision making. So the focus of XAI medicine is to support this kind of decision making tools. And there are many challenges. Obviously, there is no a final and global solution to XAI medicine, because explainability is also depending on the people you have to explain something. So it is different if you want to explain the clinical conclusion to a physician with respect to the explaining the same clinical conclusion, but to a patient that want to understand why some conclusion have been reached. So there are different techniques, but mainly there are common challenges of XAI medicine that are related to the interpretation of the result. You have to understand what is the content of the data, what's the real information hidden in the data. You have to explain the result. You move from knowledge and data, not only from data to explain. When you interpret, it is enough to have the comprehension of what is in the data, to understand what is the result of this processing. When you have to explain is another level. You have to also know the basic knowledge that allows you to reach some conclusion. And it could be that XAI is also important for inferring new knowledge from the data. So I'm at the end of this presentation, very short. With other colleagues, we discussed about what is XAI in medicine, and we reached some kind of conclusion that explainability is in the intersection of many different concepts. Two of them have been already introduced: understandability and interpretability. You have to understand why you reach some conclusion from data, and you have to understand how the system works for reaching this conclusion. But then there is also usability and usefulness, in the sense that an XAI-based system has to be usable by the user. If the user is not able to interact with the system, he is not able to get the message from the system, so the usefulness could be very, very low. So what is the difference in our view between interpretability and understandability? Interpretability is the degree to which a human can predict the model result. If you see the data, you can, even though you don't know how the system works, according to many experiments, to many execution of the system, in some way, you can understand why what the system will predict. Understandability is a little bit more related to the internal behavior of the system. You have to know how the model works. The similarity I'm doing for understanding the difference between these two concepts is when you drive the car, you are able to understand what is the effect of pressing for improving the velocity or the speed of or you are stopping the car and so on. It is not requested that you know how the engine and the other mechanism of the car are working. That's the interpretability. And then understandability is, you know how the car is behaving according to its internal structure. There are two different plans, and sometimes it is enough to interpret, sometimes you need also to understand.